We all know that cervical cancer is the second most common cancer in Asia, in the women. Very, shocking to know that only 1% of the girls reported of receiving the HPV vaccine in entire Asia. So this is very poor. Is the HPV vaccine safe? Yes. If we do not take care of this now, the India very soon is going to be cervical cancer hub. So there is very urgent need to fill this gap. We have to educate our patients. When you say that HPV vaccination has to be taken, don't just say lightly. It has to be taken. So the lack of awareness is a very big hurdle. So educate and educate us. We have to first vaccinate our family and then we have to vaccinate our friends. Still 68% countries have already included HPV vaccine in their national program. WHO goal by 2030 we want to eradicate cervical cancer.
As practitioners, we all know that we are very poor at it. So let's learn from her how to counsel for HPV vaccination. Thank you.
Thank you.
Mic is to you.
Thank you very much, ma'am. Respected chairpersons, Dr. Manju Verma, Dr. Anil Shukla, and dear friends. So today, in the last, I know everybody is tired and so many people have gone. So this is a very important topic. We all know that cervical cancer is the second most common cancer in Asia, in the women. So, and we all know that to prevent cervical cancer, we have two things. One is the HPV vaccination and one is the pap smear testing for HPV. These two things together can prevent cervical cancer, which is such a deadly disease. So, we all know that HPV vaccination is effective. So first let us understand 0.6 million new cases of cervical cancer are detected in 2020 and 0.34 million deaths are happening because of this. And India is reported to 21% of the total cervical cancer cases. You know the cumulative risk of any women having cervical cancer in their lifetime is 2%. The incidence rises at 30 to 34. It peaks around 55 to 65 years. So that is why the need for HPV vaccination, which is the only vaccination against cancer. So what is the problem? The problem is with the counseling. I think the doctors themselves are confused. So if we are confused, how we are going to counsel? The patient comes to us, we write HPV vaccine, and then there is, in our busy schedule, there is no one to counsel the patient. So that is very important to educate and take some time in counseling. So that effective HPV counseling is the need of the hour. There are many questions, frequently asked questions. One of my friend also came for the vaccination with her daughter, but they were apprehensive. They must have read that some serious event has happened, which has not happened, but some paper has reported. So they are, scared. And there are so many myths about this vaccination and so many concerns that even the doctors have about this. We all know what is HPV infection. HPV infection, only persistent HPV infection will cause genital warts and cancer. In female, if we talk, it will cause cervical, vaginal, anal and vulva. But if we talk of the male also, it can cause penile cancer and oropharyngeal cancer also in the head and neck area, even the tongue and even the tonsil. So it not only causes, first myth is that to do an effective counseling, we have to be sure that okay, this vaccine is effective. That how the vaccine is effective? When we give vaccine, there should be enough antibodies in the body. So various studies have been done and they all have proved that there enough antibodies are produced when we give this HPV vaccine. That means it confirms that it is effective. But the earlier you give, the better the response, because the young people, they have better immune system, so their response is better. And also it should be started before the sexual activity. Earlier the bivalent vaccine has come, then the quadrivalent vaccine came, and it is effective as far as the antibody response is concerned. But how long they are effective? So then there are various studies has been done to see how long they are effective. The longest study is that the quadrivalent vaccine was effective for more than 12 years. So they did a study, and after 12 years the antibodies level were very good. Although it needs more studies, but then it is effective. And then came the 9-valent vaccine, which is even the more effective. It covers more strains and it prevents the warts and other things also. This was, the study also showed that it is effective for a quite long period of time. And are they safe? Is the HPV vaccine safe? Yes. The HPV vaccine is very well tolerated in Indian participant. There are mild reactions at the site, and the serious adverse reactions are very few. But mind it, whenever we give a vaccine, whether it is a COVID vaccine or HPV vaccine, we always have to monitor the patient for 1 hour, and whenever we are giving any vaccine, all the drugs should be at your side. So never take any vaccine lightly, because any patient can react to any vaccine in their lifetime. So what is the reason why it is not so popular? Western countries, various countries, they have incorporated this vaccine in their routine vaccination programs. So India is also thinking of doing this. The only hurdle is the cost. The good news is that the India has also produced its own vaccine, although it needs a long study. The safety study is yet to come. This vaccine, the Gardasil, is a long time tested, so we can rely on it, and we are looking forward for the various studies for our Indian vaccine. So the cost is very important factor in our country like India, and very shocking to know that only 1% of the girls reported of receiving the HPV vaccine in entire Asia. So this is very poor, because the WHO has a goal that by 2030 the HPV should be eradicated. So that is why we have to learn how to do effective counseling. First, the very low awareness about the HPV and vaccination about women in India. Especially all of you must have seen in your practice that adolescent girls are suddenly become very sexually active and they are living in relationships. So all the more, if we do not take care of this now, the India very soon is going to be cervical cancer hub. So that is why it is all the more important to catch those girls, and even the vaccination should be done at the pediatrician level only, and as a obstetrician we should counsel from the very beginning too. So there is very urgent need to fill this gap. We have to educate our patients. As I said that adolescents, they are although involved in sexual activity, but they very less awareness. Whenever I talk to them, they will listen, but then they will say that they will talk to their parents. So they can't take decisions. They are too young to take decisions. So the lack of awareness is a very big hurdle. So educate and educate. Every time the patient comes, to whatever age, counsel and counsel again and again. It will hit sometime. So the health literacy can be done covered by the education of the doctor. You have to take little time. How to create? You can have some posters in your clinic. You can make some pamphlets. When you say that HPV vaccination has to be taken, don't just say lightly. It has to be taken. It can be taken, and it has to be taken, because when a doctor says, the patient will ask you, is it really important? Then there is your role. You have to say strongly, it is very important for your future, so it has to be taken, and that message has to go to the parents as well. So also very important time to catch these girls as for our obstetrician is the postpartum. Immediately postpartum, the patient is in your hospital, you have time to take round and talk to the patient, and in the lactation it is not prohibited, it doesn't pass in the milk. So that is the best time to catch those women who are not yet vaccinated. So what are the some frequently asked questions? How can, we all know now that how can we prevent the HPV infection? By screening for cervical cancer for HPV, that has to start at 21 years and has to continue till 65. When we were studying, that time the HPV start time was 30 years. Now it is reduced to 25. Now the HPV testing has to start from the 25 years, and every 5 years, even if no abnormality is found, it has to be continued till 65 years. And second is HPV vaccination. The earlier they started, the better. 9 to 14 is the ideal time when we can give only 2 doses, but if we have missed that, we can definitely give till 45 years. There was a conference when it was an international conference. So when I asked them, so can I take HPV vaccine? They said anybody can take, even at the age of 60 years it can be taken. We recommend 45 years because all the studies are done till 45 years. There is no contraindication for age. It is not that if you give at 50 years something bad is, some protection will be there. The protection will be less. And the third most important, we have to educate our adolescents about the safe sexual practices, use condoms, that is also. Earlier 3 types of vaccine were available in India, bivalent, quadrivalent, 9-valent. Nowadays bivalent is not available as such. So the quadrivalent and now the 9-valent is available. One very important question, because most of the people who are very aware, they have taken quadrivalent vaccine and now they want to take nanovalent. So what should they do? They can wait for a year and then they should repeat the 9-valent vaccine. So this is one question answered. So bivalent vaccine was offering only the 70% of cover for the HPV 16 and 18. But nanovalent vaccine covers 90%. See, if any vaccine can prevent 90% prevention against the HPV infection, which is the main cause for cervical cancer, it should be implemented very, very strongly. But who should get vaccinated against HPV? All females. When it came in India, it was only for females from 9 to 45 years. Then came the nanovalent, although it is written here from 9 to 16 years, but now FOXI has recommended it to till 45 years. And although it is written that for male it is 9 to 15, but of the side, you can give up to, it's similar, up to 45 years in males also. Because there is no effective way to test HPV infection in a male. How will you test in a male? But male are equally infective. In fact, they are transferring the infection to the females. So they have to be vaccinated if we want to prevent cervical cancer in female. And how many of you have really vaccinated your children, including boys? Can you raise your hand? So it is very important for us that we all AOGS members should take a oath that at least they will vaccinate their children. That is how we can start. I have vaccinated all my children. Only one daughter-in-law is remaining. I have to vaccinate her also. Both the sons I have already vaccinated. So the question asked is, can you give HPV vaccination in pregnancy? The answer is no, because there is very limited data. But if you have given a vaccine and if the patient becomes pregnant, there is no problem. The patient can continue. What should be, so you can continue. So what should we do if the patient is very immunocompromised, suppose HIV or very, very ill? Suppose you have any viral fever also, so you should abstain from getting any vaccine. You should wait, when you get well, then take vaccine. And there is very less studies on the effect of the vaccine in immunocompromised, because see, patient is already immunocompromised too much. So the vaccine will not produce antibodies. The response will be very less, and there are very less studies also on this. So it should not be used in a very immunocompromised patient. Otherwise, everybody can take in a minor illness, wait for the illness to get over, and then you can definitely take. The good news is that when you are breastfeeding, you can definitely take HPV vaccination, and even the vertical transmission to the fetus is also very rare. Transplacentally is also not transferable. So the breastfeeding is the time we can do the catch-up vaccination. So if what happens, the girls, they are already sexually active. Ideally it should be given before becoming sexually active. So when they have become sexually active, will it work? Yes, it will work. So we have to give vaccination. We can't say, okay, now she is sexually active, already may be infected, so we will not give vaccination. No. Even if she has become sexually active, we can give vaccination in these girls. Now another question many people ask, so what happens, already I have one HPV infection, now should I take vaccination? Yes, because you may be infected with one strain and you have the chances of becoming infected with the other strain. So what should you do if a patient is HPV infected? Now you should find out the strain. If she is infected with a strain which is more cancerogenic, like the 16 or 18, you should do further testing like colposcopy and all. There are good chances that infection will heal by itself, but do you like to wait? No. So even if my take home is that even if you do colposcopy, and even if it is colposcopy little abnormal, you have to do thermal ablation or cryo, whatever you want to do. But even if she is everything is normal, then also either she has to follow very closely, or will you wait for her to become cancerous? No, because the transformation zone, if you do ablation or cryo, whatever, so then the chances of HPV getting healed is even faster or better. So these women should be treated if HPV is positive, and secondly they should be vaccinated, and further pap smear should be done. So we all know what is the dose. 9 to 14 years, 2 doses at 0 and 6 months. 15 to 45, once she crosses 14, we have to give 3 doses, 0, 2 and 6 months. For the male, it is the now same. Why we recommend vaccine at a certain age? I have already explained, because of a good immune system. So immune response is better at the young age. Who should not receive HPV vaccination? People with a life-threatening illness, or if they have allergy to previous reaction. They are very prone to, some people are very prone to allergy to anything. Here we can give some test dose and then we can wait. Pregnant women confirmed do not give, and people with the moderate illness should wait for the illness to subside. When they are well, then only give. So what happens if I have taken a dose and I missed? Now do I have to repeat all over again? No. Now they say that you start from your missed dose. So if taken one dose, you start from the second and then take after the 6 month the next dose. And recently some studies are going on telling that even the single dose is effective. So lots of paper are being written on single dose effectiveness, because in a country like India, which is very poor, even the single dose can prevent. So those who cannot afford 3 doses, at least give 1 dose. So this can also be conceived. Or if I have taken 1 injection, earlier it was happening more when Cervarix was there. Now because it is not there, so this is happening less. So can I take another injection? Because if you go other part of the country, one of the patient came from outside, so she had to take the. So as far as possible you have to should avoid take the same injection possible. If you take a quadrivalent, you have to take quadrivalent only. And can it be taken with the other vaccine? We all know that this is the era of the adult vaccination. We all have to take meningococcal, gonococcal, DAP at this age 40 plus everybody should take. So it can be safely taken with all other vaccinations. And it is of course well tolerated. I have already explained this. So there are some myths still. People will say that okay, I have a HPV infection, so immunity should develop in my body. Why do I need to take a vaccine? So when you have infection, the immunity doesn't develop well. So natural infection will not impart immunity in your body, so you have to take a vaccination. And earlier I have said that it does not only prevent from cervical cancer, it prevents from various types of other cancer in the female vulval, vaginal and the anus cancer, and in the male from the oropharyngeal, head and neck, tongue, tonsil and penile cancer also. So some people will say that pap smear I have done, so I do not need to take. No, both are important. They have their own role. I have already explained this. One cannot replace another. So you have to take vaccination and you have to do pap smear. Both has to be taken. The age has been reduced to now 25 years. From 25 to 65 years, every 5 years pap smear plus HPV has to be done even if it is normal. And now earlier it was not for boys, for now it is for both. It is for girls and it is for boys. Because in fact, as I told you, there is no good test to test in the screening nahi hai. You can't screen in the male. In the male only if they have wart, you can collect specimen from the wart, or you have to do anal. But it is very cumbersome, and you know the males will not come for a screening. Will they come to you for the screening? To the obstetrician to nahi aayenge. I don't know to whom, they are very reluctant. And the HPV transmission from the female to male is higher than from the male to female. That is also one reason. The female will keep infecting to male. And people think that HPV effectiveness will reduce over time, but various studies, I have also covered this, have explained that it is effective for a long period of time. One myth is that it contains harmful ingredient. No, it does not contain any harmful. It contains little aluminum, which helps to boost the body's immune response to the vaccine. And aluminum containing vaccine have been used for decades and they have been administered for more than 3 billion people. So now it is totally safe. In India, the HPV vaccine came in 2008. In 2009, in Gujarat, some incident happened and then it was stopped. And then again in 17, 18 and 19, it is again started by Sikkim, in Punjab and in some parts of Delhi, and very good response has done. And now I think Modi ji is thinking of incorporating in the national immunization program, but we don't have to wait till then. So we have to start now. And some people think that it will impair fertility. No, but it has no effect on the fertility also, and it does not cause infertility issues. Some people think that it can transmit the virus and cause cancer. No, it is not a live virus. There are a lot of research are going on to find a vaccine which can be therapeutic. So they will be HPV therapeutic vaccine. So a lot of research is being done on that, but till today no therapeutic HPV vaccines are available, and it cannot transfer any virus and cannot cause cancer. So then again when you will do counseling, lot of questions will be asked that I think that HPV vaccines may not have any benefit, it can cause reaction. Why does my son need the HPV vaccine? Can HPV vaccine be avoided by just using condoms? I am using condoms, the adolescents will say. So I will not get any HIV infection. But see, the HPV infection does not only transmit by penovaginal insertion. It can transmit by other means of sex. even by digital sex, even by oral sex, even by kissing, because it spreads by mucous membrane. So just by using condoms you cannot prevent HPV vaccination, and this counseling has to be done to your patients. Yes, a pap smear is definitely needed even after that. So HPV vaccination is a key to cancer prevention, and we have already covered all this. Vaccination for boys and girls, the age, the earlier started the better, and diseases what can prevent by not only the cancer as I said, but warts also can be prevented by the. There are 400 types of HPV and there are 15 cancerogenic types of HPV. So when you do HPV testing, you can do the genotyping. If you find HPV positive, you should ask your pathologist to give the strain, which strain she is positive and uska kya percentage hai. So that way it will be more effective to treat the later on, and it is of course the safe and vaccination for the children. The motto is before they become sexually active for both boys and girls. It cannot be avoided just by using condom. Pap smear needed. So the WHO, I will conclude by saying this, that we as a gynecologist, we have to first vaccinate our family, and then we have to vaccinate our friends whosoever near us, and then we will meet again in AOGS and we will ask how many of us has really vaccinated our family. So that is very important, because we as a gynecologist, we do not do our pap smear only. How many of us go for mammography? How many so that is, we have to do what we are telling our patients, we have to do ourselves. Then only we will be able to eradicate the WHO goal by 2030. We want to eradicate cervical cancer only by combined policy of HPV vaccination and pap smear screening. Currently now only 2 vaccines are available, and it is countries should have to find such goal, like India also has to. Still 68% countries have already included HPV vaccine in their national program, even after 17 years of license of the first prophylactic HPV vaccine. So that is too low. हम छोटी छोटी चीज़ों में तो बहुत सा पैसा खर्च करते हैं. If you properly counsel, so cost should not be a bar, I think, because everybody can spend some money on their health, and on their children's health you have to counsel the parents. Thank you very much for that.